I want to start off by saying something provocative.
So my name's Mark Davies. I'm the Chief Health Officer for IBM.
I think this concept of an integrated neighbourhood is probably the most significant healthcare innovation of a generation.
So connected neighbourhoods are critical to the future of healthcare for one very simple reason. We need to start intervening earlier and earlier in the natural history of disease and ideally preventing diseases happening in the first place. And we know that the majority of outcomes of diseases are dictated by factors other than direct healthcare. Things like people's environments, their social networks, their leisure facilities, and their housing. So if we're going to get real about addressing the balance between demand and supply in healthcare, we need to use technology to knit together and start to make use of those assets within a connected neighbourhood.
Healthcare's in trouble. You know, this isn't just the NHS, this is a global phenomenon.
So as the Chief Health Officer in IBM, I work at the interface between healthcare and technology. IBM sees itself as a digital transformation organisation, so supporting industries to rethink their services and kind of reimagine them based on design thinking and harnessing the best technology that we have available.
I genuinely think that we are on the cusp of healthcare 3.0, when neighbourhoods actually becomes the most significant instrument of delivery and instrument of transformation.
So this ISO standard is really important. One of the problems that we have in healthcare and social care and care settings are the words that we describe things. Even when we use definitions of words, very often in different settings, people have a different understanding. So the way to kind of light that up and make it real is to have a functional definition. So not to describe the anatomy of a neighbourhood, but to describe its physiology. And that's what an ISO does. It gives us a way of describing how they behave, what impact they've got, and critically, the metrics that we can use to kind of define success. And in that way, we all start talking from the same framework, and we can use that as a way of coalescing the conversations and the policy and projects internationally.